Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 8th video of repeat revision course of oral and maxillofacial surgery, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about cyst in detail. We will discuss about definition of cyst, classification of cyst, and next is the diagnosis of cyst and different management techniques like enucleation, mercifulization, and we will discuss important point regarding each cyst, because in last NLE attempt, March exam, mercifulization and enucleation MCQs and OKC odontogenic keratocyst MCQs was come. Now, how we define cyst? A cyst is a pathological cavity or sac with a hard or soft tissue lined by epithelium or non-epithelium tissue and containing fluid, semi-fluid or gaseous content. Means cyst is a pathological cavity. The first thing. Second is it may be lined by epithelium or not. If not epithelium, this is known as pseudocyst. Epithelium, this is cyst, and containing either fluid, semi-fluid or gaseous content. Now come to the classification of orofacial cyst by Scheer and Kramer into cyst. They classify cyst into three types. Number one, cyst of the jaw. Number two, cyst of the maxillary antrum. Number three, cyst of the soft tissue. In cyst of the jaw, then again divided into epithelial and non-epithelial. And in non-epithelial there is two types: traumatic bone cyst, or also known as hemorrhagic cyst, and second is ABC, in Erasmual bone cyst. Then in developmental, in epithelium there are two: developmental and inflammatory. In inflammatory, this is odontogenic, due to teeth they develop, and then this is radicular cyst and residual cyst. Radicular mean around the apex of the root. When we remove the root and the remaining cyst is remain, this is known as residual cyst. Next is the developmental, and developmental there is two: odontogenic and non-odontogenic. Odontogenic is due to mean from developed due to infection come from teeth, and non-odontogenic the infection not come from teeth. In odontogenic there is a primordial or so known as keratocyst. Second is the dentigerous cyst, which is formed around impacted third molar. Next is the eruption cyst, when our tooth erupt with that cyst is formed around that teeth. This is eruption cyst. Next is the lateral periodontal cyst, mean this is developed in the periodontal region and laterally to the tooth. Next is the gingival cyst, and they erupt in the gingiva. Next is the calcified odontogenic cyst or Gorlin cyst. Next is the basal cell Nevis syndrome, and next is the botryoid odontogenic cyst. In non-odontogenic, there is a nasopalatine cyst, also known as invasive canal cyst, because present in the incisive canal region. And next is the nasolabial cyst, also known as nasoalveolar cyst. Next is the median alveolar cyst, median palatal cyst, mid palate, median mandibular cyst, and a globulomaxillary cyst. In cyst of the maxillary antrum, there is a benign mucosal cyst and surgical ciliated cyst. In cyst of the soft tissue, there are dermoid cyst, epidermoid cyst, benign lymphatic cyst, salivary gland cyst, which is mucocele, and thyroglossal duct cyst, which is due to remnant of thyroglossal duct, and parasitic cyst, and interior lingual cyst. Now come to the diagnosis of the orofacial cyst. The diagnosis of cyst is done by combination of the following method. Number one, history taking and clinical diagnosis. Second is the radiographic diagnosis to differentiate uniocular or multiocular cyst lined by radiopaque border of the sclerotic bone. In radiograph, in cyst on the border there is a radiopaque border. And histopathological next technique is the histopathological diagnosis by biopsy procedure, and next is the laboratory diagnosis. Now come to the treatment of the orofacial cysts. Now, a cyst is mostly treated by surgical method as this lesion increases in size, destroys surrounding bone, weakens the jaw, ultimately leads to pathological fracture. Involve erupted or unerupted teeth or encroach upon important vital neighboring structure. Despite all these complications, in certain cases, surgical treatment is not performed. These conditions are small asymptomatic cysts or patient with complicated systematic illness. The objective mean in a small asymptomatic cyst or patient with complicated systematic illness, we do not surgery, and mostly the treatment of cyst is surgical method. The objective of the treatment of a cyst are there are four objectives. Number one, the removal of the cyst lining or a device to position of the abnormal tissue to ensure its elimination from the site. Second, preservation and respect to the adjoining important structure. Third, conservation of healthy teeth, either erupted or unerupted. Fourth is the restoration of the affected area to its normal or original form, shape as far as possible. Now, after objective, the various surgical procedure are three types in treatment. Mercifulization or decompression technique, in which we make a pouch due to marsupial enamels. In Australia, this name is given because here we make a pouch. Or decompression mean to decrease the pressure, also known as PARS 1 technique. Second is the enucleation method. Then in enucleation there are three methods: enucleation with primary closure, enucleation with packing, and enucleation with primary closure and reconstruction mean graft surgery. And third method is combination of enucleation and mercifulization, which is the PARS 2. Now, first come to the mercifulization or decompression technique. It is a procedure of surgically creating a window in the cyst wall which is continuous with the mucosa and then evacuating all of the cystic content. We do not completely remove the cyst, we creating a window and remove the cystic content. What are the indications? In case of large cyst located in inaccessible area, we do mercifulization. These indications are very important. Second is the enlarged cyst with weakened cystic wall. Third, for dentigerous cyst. In young patient where teeth eruption is necessary, because dentigerous is denti mean teeth, gerous mean holding. This is a cyst which inside there is a teeth. It is occur around mandibular impacted third molar. In young patient, in order to the teeth eruption is necessary. And the next indication is in patient where complicated surgeries are contraindicated. Now come to the advantages of mercifulization or decompression technique. Why decompression? Mean we remove the cystic content to decrease its pressure, therefore known as decompression. Now in advantages, it is simpler and easy procedure. It spares the vital structure. The procedure also allow the teeth to erupt. It requires less time. This is less blood loss in the procedure. It is conservative method as it preventive. It preserve bone height. Now in disadvantages, in this procedure the pathological tissue are not completely removed. It take increased healing time. It require prolonged follow-up. There is a greater chances of recurrence. Look at diagram here, mercifulization. And now in procedure, the step involved for mercifulization of a cyst or administration of anesthesia. The cyst is aspirated. An inverted V-shape incision made around the cyst. The flap is reflected and the bone underlying is revealed. The bone is removed along with the periosteum and cyst lining. Irrigation of the wound is done. Suturing of the cyst lining on the edge of the oral mucosa is done. Pack the cystic cavity with the gauze dipped in the antibiotic ointment, iodoform, eugenol and white head varnish. Plugging up cavity is done. Patient should be recalled for routine and regular follow-up. Now come to the enucleation. It is a process of surgically removing a complete cyst. Here we completely remove the cyst. Tumor or an organ, and the space filled with the blood clot which is covered by flap reflected. And 14.3 is the enucleation with primary closure. In indication, what are the indication of enucleation? For management of odontogenic keratosis, OKC, because due to high recurrence rate, we do enucleation. Second, in case of a recurrent cyst. Third, in small cyst. What are the indications? What are the advantages? Healing is rapid if primary closure is attained. In this procedure, the complete cyst lining can be examined and post-operative care is less. Now come to the disadvantages. In this case, the teeth have to be generally removed, because in this case the teeth will be removed. This procedure cannot be done if cyst near the vital structure like sinus or nerve bundle. This procedure weaken mandible and make it prolonged to fracture. Now in procedure, the step performed during primary closure are anesthesia administered. Incision is placed parallel to the cyst on the hard bony structure either intraorally or extraorally. Reflection of the mucoperiosteal flap is done if required. Then the overlying bone is removed. Then the cyst is separated from attached structure. Complete retrieving of cyst is done. Irrigation of the wound is done. Suture the flap back. Now the next technique in enucleation is the first is the enucleation with primary closure. This is second is the enucleation with packing. The procedure the procedure of this technique is similar to that of primary closure and is indicated in condition where large cyst remove is to be done and clot stabilization is difficult. Iodoform, gauze or other antimicrobial packing is given, which is regularly changed until the lesion shrink, followed by primary closure. Then we do primary closure. Mean in that the lesion which primary stabilization mean primary blood clot is difficult. Then first then we place a pack of gas. Then after that we do primary closure. Next is the enucleation with primary closure and reconstruction surgery. This procedure is done in case of large cyst removal using stainless steel or titanium reconstruction plate. Here autogenous bone graft taken from iliac crest or rib can be used, which is immobilized by intermaxillary ligation and fixation. Now come to the third procedure is combination of enucleation and mercifulization, which is known as PARS 2. This procedure is performed in case of large cyst removal. It is a two-stage procedure. It involves in stage 1 mercifulization to allow shrinkage of cyst and stage 2 enucleation to remove the reduced cyst completely. Now come to the complication of treatment. In the complication of the treatment, there are edema and swelling, infection, hematoma, neural injuries, tooth being non-vital, orodental and oronasal fistula, pathological fracture, recurrence of the cyst, malignant transformation. In some cases, a more conservative approach is used. Nowadays, a more conservative approach is used mainly to prolong the surgical procedure. This is chemical cauterization. This is a new technique in treatment of cyst, which is the chemical cauterization. For this, the chemical solution used are number 1 Corneys solution, which is very important. Its composition 60 ml absolute alcohol plus 30 ml chloroform plus 10 ml acetic acid, mean 10 30 10 60 30 10. Second is the phenol brushing followed by rinsing with 95% ethanol and saline. Now the chemical cauterization is also used after the surgical process to prevent recurrence. Now nowadays, if we do enucleation, after enucleation we will do chemical cauterization. Nowadays we do not use a single procedure. With surgical, we in every procedure we also use chemical cauterization. Now come to the some important table. We should in this cyst detail is necessary. First is the OKC or Primordial Cyst. Its name, pathogenesis, clinical feature, radiographic feature and treatment. In pathogenesis, stellate reticulum in the enamel organ disintegrate to form a cystic cavity lined by inner and outer enamel epithelial cell. The clinical feature mostly seen in young adult male, mandibular, third molar and supernumerary tooth are most involved. Rarely any other fracture seen except missing of tooth involved. In a radiographic picture, a well-defined multi-ocular radiolucent area bounded by smooth cortical bone. In treatment, enucleation along with curettage is done. Mercifulization is not done because it is due to recurrence. Next is the dentigerous cyst. Dentigerous cyst is found around the impacted third molar. In pathogenesis, cystic proliferation of cell between the dental crown of the involved impacted tooth and reduced enamel epithelium covering it leads to formation of the cyst. In clinical features seen in any age and mostly in impacted mandibular third molar, expansion and destruction of the cortical bone leading to facial asymmetry. In the radiographic feature, varieties are three in central, lateral, and circumferential. Means circumferential whole from every area they cover the tooth. In central they are in the center of the crown. In lateral they are the mesial or on the distal side of the crown. In treatment, in dentigerous cyst we do mercifulization in the case of large cyst. Next is the mucocele. We know mucocele is the mucus retention phenomena. It is due to trauma and it is due to obstruction in salivary gland. And in clinical features, there is a dome-shaped, circumscribed, bluish, translucent swelling mostly in lower lip, pain while swallowing, xerostomia. In the rare case, deeper lesion, there may be no sign seen. Treatment is the mercifulization, and enucleation is not effective as recurrence is common. Thus, complete removal of the gland is recommended. With mercifulization and enucleation, we do a gland duct removal also. Gland removal also. Next is the ranula. It is a mucus extravasation type of cyst in the floor of the mouth, and it's look like frog belly and last anally march and squeeze. This was come in clinical picture similar to mucocele but seen in submandibular region only. In treatment, there is a surgical removal of complete sublingual gland. Next is the ABC in Erasmual bone cyst. A cystic cavity is found mainly due to trauma, venous occlusion, or hemodynamic disorder. Clinical feature seen at all stage: firm swelling which rapidly enlarge due to continued bleeding, and tender, painful, and displaced tooth. In radiographic picture, there is a honeycomb of soap bubble appearance is seen. In treatment, surgical curettage or excision of the lesion. Next is the nasolabial cyst or State cyst. The pathogenesis is remnant of nasolacrimal duct develop into cystic swelling. Clinical feature unilateral, open, painless swelling seen on the lip. Treatment is the surgical removal of the lesion. This is all about cyst. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.